Hello and good evening, everyone. Today we are gonna discuss with you what and how our the night before exams course is gonna be, and this is a very clear, very revolutionary course that's really gonna save your time a lot, specifically the night before your exam, because the night before your exam is a very, very precious night, and you don't want to spend ages and ages revising. And in addition to that, you only have got a limited time in the night before your exam to go through topics so that you can get a little bit of a time to chill out and relax and not to go to the exam whilst you're very overwhelmed, very stressed until the last minute before you go to bed. So, the night before your exams course this is what we are going to teach in our final revision course. So our final revision course consists of very important topics and ways of how to quickly cram and revise the topics that you are very aware about, but you only need a quick reminder before your exam. So let's go for it. For example, we are going to speak about men's health now. So what we are doing here, we are dividing men's health now into different categories, different ways, as you can see. And what we do is that, for example, if you go through the prostate health and PSA, when you go for that, tells you what kind of symptoms to ask about. For example, urgency and leakage, weak or interrupted stream, incomplete emptying, nocturia. So these are the most important questions that you need to ask about. Red flags, what are your red flags for prostate issues? So visible hematuria, weight loss or bone pain, urine retention. So these are very important questions that you need to ask whenever you are going through the red flags before your exam. PSA request counseling. So what you need to be aware about, explore reasons for the test, explain limitations, false positives, negatives. So you need to explain that to the patient very quickly. Put in your mind, you're already aware about that, but you only need to remind yourself, oh, I'm going to say this, oh, I'm going to speak about that. And last but not least, informed choice discussion. So you tell the patient the information, gives them the chance to let you know about their final decision. Now, moving on, so going to things like erectile dysfunction, so assessment, what we need to assess about. Onset, is it gradual or sudden? Morning erections, these are very important questions to ask about. Psychological impact, you need to ask about that. And in case if it has affected the patient in any way. When it comes to management, so you'd like to bring the patient for examination, testicular penile, and also to check the patient BMI, blood tests, including HbA1c, testosterone, sildenafil, lifestyle advice. You all know about it, but just a quick reminder, quick reminders the night before your exam. So other things here, as you can see, of course, including things like Peyronie's disease, for example, what you need to know, penile curvature shortening, heart fixed lungs, urology referral if impacting sex life, reassurance often resolved. So these are points that are really, really important to go through. So this is a very, very short and brief introduction about our course. How is it going to be? Of course, it's going to be slightly more detailed when we come to our course recordings. However, when you go through it the night before your exam, you know what exactly you need to ask about. All topics are included. You can access that even good time before your exam as well. That's absolutely fine. And you will get the whole recording, the whole access, including the whole mind maps as well, which are very, very guided, as we can see, and they are very accessible and also to the point, and that's what we're all after. Thank you so much for watching my video today. I hope you enjoyed it. I hope you got good information about our final revision course, and looking forward to see you all succeed in your SCA. And I'm wishing you all have a bright future and looking forward to see you all, our GP colleagues. Thank you so much and see you later.